So this next piece is on integrated summaries. So integrated summaries are created by ASAM, which is the American Society of Addiction Medicine. This is something that regardless of where you go um, and practice with your license, this is something that all accredited facilities are going to use. And basically, an integrated summary creates a snapshot of what is going on with the client. So if I open up a chart, I should look at the integrated summary and know everything I need to know about this particular client. I shouldn't have to, go through the chart to find all kinds of information that might be necessary. So in the integrated summary explanation, I have here essentially the 6 dimensions. All right, so it's dimension 1 is acute intoxication and potential for withdrawal. And in this section, what you want to do is very briefly explain in like bullet points what's going on with the client, like what substances were they using, are they having any acute withdrawal right now, is there any concern for any medical crises, do they have a history of blackout seizures, hallucinations, DTs, things like that. So really just the absolute necessity that has to do with their current acute intoxication. If they don't have acute intoxication, then just write down a guesstimate on the last date that they may have used. Dimension 2 is biomedical conditions or complications. You want to list any chronic medical conditions the patient may have. So if they have chronic pain, fibromyalgia, diabetes, high blood pressure, high cholesterol, if they've ever had gastric bypass or any of those kinds of surgeries, that is a huge indicator, especially for alcohol use disorders, because their stomach shrinks down so much that the alcohol just goes straight into their bloodstream. So they get intoxicated really, really quickly. You also want to know if there's any medical conditions that might be induced because of the substance use disorder. So, for example, things like cellulitis, MRSA, any kind of gastrointestinal issues, pancreatitis, chronic bronchitis, if they're smoking stuff, things along that line. So that's what you want to note here. And I have some bullet points on what kind of information to include, but again, this is not everything you have to include. Just apply what is appropriate for the client that you're doing a study on. Dimension 3 is emotional, behavioral, cognitive conditions or complications. List any past diagnoses that they may have. So for most part, it's usually depression, anxiety, bipolar, and PTSD. So that's something that you definitely want to add on here. And you can also do any kind of rule outs or if they're experiencing anything because of their drug and alcohol abuse. So if someone doesn't have a history of hallucinations or schizophrenia or anything, but they've been on a 5-day coke bender, odds are they're going to be sleep deprived and hallucinating and all kinds of stuff. So that's definitely something to keep in mind. And there are some other examples as well. If in dimension 4, it's their readiness to change. So insurance companies want to know a lot about this too. What you want to do is you want to take a really good look at what their motivation for change is. And in the Blackboard weekly thingamajig or whatever that's called, I listed stages of change, and it shows and it explains what stage of change a client would be in and what's essentially going on in their head. So make sure that you identify that as well. So list what stage of change they're in, if it's contemplation, pre-contemplation, preparation, action, maintenance, or relapse. In dimension 5, relapse, continued use, or continued problem. Potential, what you want to do is know if they are low, moderate, or high risk for possible relapse, or if they're on any maintenance therapies, if you've offered any maintenance therapies, and if they've accepted or refused, if they're waiting for a Vivitrol follow-up shot, if they've had sobriety in the past, if they've had risk, things like that. And then number 6 is the living environment. So what you want to do here is just note what their living environment may be. Are they homeless? Are they in an apartment by themselves? Do they live with other people who are actively drinking or using? Are there interpersonal conflicts, chaos, things like that? And then the bottom is what you do is you take all these dimensions and you put together all this information, and then you create a level of care. And the level of care should be reasonable based on the information that is listed in the 6 dimensions. So if someone hasn't used in a year but they're just having cravings, then there's really no reason for them to go to detox or something like that, so it really should be indicative of that. If someone is having a real screaming drug and alcohol problem and they're having a really hard time, one-on-one once a month is not an appropriate care. They need a higher level of care. So then what you do is at the bottom is you create a summary. So a quick little snapshot. Include the diagnosis, an accurate diagnosis, what the referral process was for them, if they were self-referred or referred from someone else, what barriers do they face that you're going to be addressing with them, that is the reason for why they need treatment, what resources or skills do they need or do they have that could help with them, and just create a real good summary, real good snapshot. And I'll give you some examples of these along the way. Okay. Um, and I think that is it. That's an integrated summary. It's really clear cut and simple. And as we go through and you start doing some, I'll give you some feedback along the way and some suggestions, and go from there. You will get a lot of things wrong in those, and you will get a lot of feedback from me. What I'm looking for is effort in the completion of it, and you'll get full credit for it. So just be mindful of that. You won't get points taken off for an inappropriate integrated summary until like we do like a midterm or a final. So just do your best with it. Be open to the feedback that I give you and just know that this is a learning process along the way.